tomorrow. Let me get with Dr. Thomas Dobbs, who's State Health Officer of the state of Mississippi, the busiest guy, one of the busiest guys in the state. Good morning, sir. How are you?
Good morning. Thanks for having me again.
Thank you for taking the time to come. There are so many things I want to get to talk to you about. First of all, from my understanding now, anybody who wants a vaccine can schedule an appointment to get one.
Yes, anybody over 16 can get a vaccine. Now, there's a little bit of a difference because the Pfizer vaccine is for kids 16 through 18, but the Moderna is only for 18 and older. So there's a little bit of a nuance there, but yeah, it's time for everybody to get vaccinated. It's time for us to get back to normal.
Is the availability on both of those adequate enough to do that?
Well, there may be a little bit of a wait, but we're seeing, pretty steady supply from the different producers of different companies. And go ahead and get your appointment. We want to go ahead and get everybody vaccinated. We still have some efforts that are targeting vulnerable populations and older folks that are sort of ancillary to this broad opening. Our biggest challenge is there's not much Johnson & Johnson right now, and there's been phenomenal demand for that.
That's the shot that you only need one.
Yes, sir. That's right.
Is that going to be able to transcend those age groups too, or is it just going to be for one demographics as far as the Johnson & Johnson?
Yes, it's the same. So it's going to be 18 and plus for Johnson & Johnson, but there are ongoing studies, so we expect other teenagers will be eligible soon.
Well, let me ask you this, just to kind of go over a little bit, because we've added some other places on here that you can get the shots. So just kind of a category of where, beside the drive-thrus, where else can you get the shots now?
Boy, you can get them a lot of places. A little bit less than half the vaccine goes to our drive-through operations, and that's been a fantastic way to get vaccines for folks quickly, right? But they're not everywhere. We've only got about 24 locations, but we have hundreds of pharmacies that are now getting vaccines: CVS, Walgreens, some independent pharmacies, Walmart. We have hundreds of clinics, private clinics that have gotten it. We have about 43 Center of Excellence hospital health systems that are helping us get the vaccine out. So go to our website and see. We've got hundreds of places to get the vaccine now.
I will say this. I've heard more people talk about maybe some reaction from the Moderna than the Pfizer, but even those have been just temporary, a couple of hours or maybe overnight fever for the most part. Have you heard anything as far as Johnson's concerned, Johnson & Johnson, as far as some negative feedback on that one?
It's the same sort of thing with the Moderna and the Pfizer. We have seen for some people they've had temporary transient, achiness, sort of fatigue, maybe low-grade fever. But it's something that we've seen more frequently in people who've had COVID before, which makes sense. So people who've had COVID before, we give them the Johnson & Johnson shot, their immune system's already primed. And it's these temporary symptoms are really just your immune system ramping up to sort of fortify your immune response. And it's these inflammatory chemicals associated with that make people feel bad. But it's temporary, and it's certainly well worth it. And it's not common.
Yeah. Have you heard of anybody who's had maybe early on, who got the vaccine that came down with COVID again, even to a milder symptoms? Anybody at all?
We have seen a few, and we're continuing to look at some. We're actually, if you look at the vaccine, it shows it's 95% effective against any symptomatic disease. And so, that just means that, 5 out of 100 infections are going to occur, but we haven't seen any severe disease so far in people. What we have seen a lot of is people who got one shot, and then like within a week or two, they happen to get COVID because their immune system wasn't built up, and they may have been exposed, around the same time as their vaccine.
Did they fare the same way as far as getting over it?
Some of them have been pretty sick. So you really need to, be several weeks out from your immunizations to sort of have that effect. Kind of like with the flu shot. We say it takes 2 weeks for the effect to kick in. But I will say for people who have been fully immunized, it's been fantastic. I mean, it's really been remarkable.
Even that said, I think we're going to get in this period of time where we're going to drop some of the masks, but there are a lot of people still wearing them who've had the 2 shots, and I think that's probably going to continue for a while.
Yeah, we're making phenomenal progress. And I think if we really want to reinforce our economy, if we want to be able to, have sporting events and travel from a population and an individual level, it's time, get vaccinated. Just look at the success in Israel and in Great Britain. And I think we're close behind them. But I think the masks are a prudent, simple step for a little bit.
I was going to say, when you start looking at the effectiveness of this, we have done a pretty darn good job in the state of Mississippi. I'm surprised how many people we've got it covered already in the state. And when we start talking about herd immunity, that's still a ways off yet, but we're getting closer.
Yeah, we are getting closer. It's going to take a little while. Where we have been extremely successful, and this makes sense, right? So we targeted older folks who are more vulnerable, more likely to get severe illness or die. And if you look at the 75 plus, we're looking at 60% of the population is already vaccinated. If we look at 65 plus, over 50%. So we just got to keep our foot on the gas.
Have you heard anything else as far as mutation of this?
We have seen, quite a few, about 10 strains of the UK variant in Mississippi. Now, that variant does look like, or that strain, right? It looks like it's more contagious, but it's still a minority. But fortunately, the vaccines that we have seem to be highly effective. We are certainly watching some of the other ones that might potentially limit the effectiveness of the vaccine, but even those other mutants, it does prevent severe illness and death. So there's significant, protection.
One of the things that I don't think there are a lot of questions still out there about the virus itself. One of the things that I don't think anybody's ever answered completely is how long is the immunity from the shot? Do we know? Is it going to be 6 months, a year? Is it going to be longer than that? Has anybody delved into that, or do we have any more concrete answers on just how long these shots are going to last?
Yeah, no, that's a fantastic question. And we know based on some, studies of the immune response and what the level is, it looks like it's going to be at least a year or more. It might be considerably longer, but obviously we haven't had it a year to know for sure how people are going to fare. Now, there will be some interpersonal variability, so that might not be the same for everybody, but it looks like it's going to be pretty strong, and the immune response from the vaccine may be even better than from natural infection.
So the next round of vaccines coming out, will they be the same as this one, or will they vary a little bit?
There are several different vaccines that came out of the Warp Speed initiative. We have 3 of them now active, right? We have the Pfizer, Moderna, and the Johnson & Johnson. The AstraZeneca is very similar to the Johnson & Johnson, except for it's a 2-dose, and that may be on the horizon. The other one that's going to be exciting is a Novavax coming out. That's a different one. It's more like the traditional flu shot. It's just the sort of surface protein, the spike protein, and the numbers look really good on that. So that's on the horizon.
Almost out of time. Real quick, status report as far as the medical marijuana situation and the health department. What's the word on that?
We're working on it. We're just going to try to be good stewards of our responsibility to meet the deadlines and run a responsible, safe program that protects the vulnerable, but meets the intent of the Constitutional Amendment. It's our constitutional duty. And although we have some reservations, we'll try to do it as proficiently as possible.
You got it.